Welcome to Lecture 10, Emotion. When generally looking at what are emotions, that's a very difficult thing to answer. Strong emotions tend to release or increase readiness for action, and most general theories of emotion deal with this relationship between emotion and action. One of the most common theories of emotion is the James Lange theory of emotion, and this is autonomic arousal and skeletal actions occur before an emotion. An emotion is the label we give to our physiological responses. In this theory, emotions have three components. There's cognitions, actions, and feelings. The cognitive appraisal of a situation comes first, which leads to some action, and then the emotional feelings follow last. A good example of this is panic disorder. This is a condition marked by episodes of extreme sympathetic nervous system arousal that the person interprets as fear. Perceptions of our bodily reactions are important for interpreting our emotions. We recognize extreme arousal as extreme fear or panic, and stimuli that induces smiling or laughter are considered pleasant or amusing. The brain areas associated with emotion. The limbic system is the big one. It's an area that forms a border around the brainstem and is traditionally regarded as critical for emotion. Brain areas are responsible for different types of emotion, and they have been investigated and found highly variable. One of the best localized emotions is disgust, which has been shown to be in the insular cortex. The right hemisphere of your brain appears to be more responsive to emotional stimuli than the left, and the right hemisphere is especially activated by unpleasant emotions. Then the functions of emotions. Adaptive advantages of some emotions are clear. For example, fear alerts us to danger, and disgust helps us avoid illness. They may also allow us to make these quick gut decisions. Typically, when somebody's making a moral decision, we work out first what feels right and then justify it logically. Emotions can impair reasoning, but lack of emotions can also lead us to poor decision making. Look at willpower. Here's willpower. We look at willpower. I have a video here I'm not going to show on this particular video, but I'll show it in class. Willpower is directly related to self-control. We use it every day in just our common decisions. And one of the interesting things is willpower can be learned and willpower can be depleted. What's not known is what is depleted in the brain when willpower runs out. And one possibility is blood sugar. The frontal cortex seems to be the seat of the willpower, and the level of willpower is the best predictor of future success. And my little video here is talking about a marshmallow experiment. And we'll talk about the marshmallow experiment in class. Willpower, and we do know this, willpower can be increased. Long-term exercise of willpower increases the pool of willpower. For example, military service increases willpower, as does learning a musical instrument. Happiness is another area that it can be learned. There seems to be a set point for happiness, that happiness results from our choices. And large events in our life don't seem to affect long-term happiness, like winning the lotto. You may become happy for a short time, but it doesn't affect our long-term happiness. It's repeated small events that affect our long-term happiness and can actually change our set point in happiness. We look at hereditary and environments, especially when we're looking at violence here. Environmental factors do affect somebody's level of violence. Specifically, ones that are known are exposure to lead or exposure in the fetal developmental process of nicotine can significantly increase somebody's violence. Among non-human animals, male aggressive behavior depends heavily on testosterone. In humans, men with higher levels of testosterone have on average slightly higher rates of violent activities and criminal behaviors than do other men. A recent study found young women injected with testosterone were less accurate at identifying angry facial expressions. Other studies show that testosterone increases the response of the amygdala to angry facial expressions. Serotonin and the behavior of your synapses is an aggressive behavior. Researchers have found that social isolation induces a drop in serotonin in the brains of male mice, an effect that further increases the possibility of aggressive behavior toward other males. And these effects are not found in female mice. Data from human studies suggests that a lower than normal level of serotonin in those convicted of violent crimes, as well as those who committed or attempted violent suicide, they have less serotonin. The neurons synthesize serotonin from tryptophan. Tryptophan is this amino acid that's found in proteins. A diet high in other amino acids but low in tryptophan impairs this brain ability to synthesize serotonin. One study found an increase in aggressive behaviors in young men a few hours after eating a diet low in tryptophan. Serotonin's role in aggression is complicated. Some people with low serotonin levels become depressed, not aggressive, and the brain has been found to release serotonin during aggressive actions. And along the same lines, we look at escape, fear, and anxiety. Fear and anxiety are very, very closely related emotions. Fear is associated with a strong tendency to escape from an immediate danger. And anxiety is this general sense that something dangerous might occur, and it's not associated with escape behavior. Behavioral medicine, we're looking at stress and health. Behavioral medicine emphasizes effects of diet, smoking, exercise, and other behaviors on health. Stress is this non-specific response of the body to any demand made upon it. And the general adaptation syndrome, sometimes known as general stress, is a generalized response to stress that includes the following three stages. First there's alarm, then there's resistance, and then there's exhaustion. Stress activates the hypothalamus, which sends messages to the anterior pituitary gland to secrete this hormone called ACTH. This hormone stimulates the adrenal cortex to secrete cortisol, which increases blood sugar levels and enhances the metabolism. Effects of stress on the immune system. There's a fairly new field of study out called psychoneuroimmunology. And psychoneuroimmunology deals with the way in which experiences, especially stressful ones, alter the immune system, and how the immune system in turn influences the central nervous system. The body handles powerful, inescapable, but temporary stressors like illness with things like fever production, increased sleep, and decreased appetite. Prolonged stress, however, leads to prolonged increase in cortisol and other hormones, which direct energy towards increasing blood sugar and metabolism by shifting energy away from synthesizing proteins, including the immune system proteins. If stress continues for weeks or months, the immune system may weaken, leaving the individual vulnerable to many illnesses. High cortisol levels may impair memory and increase the vulnerability of neurons in the hippocampus, so that toxins or overstimulation will kill neurons. We're looking at stress control. Specifically, I want to talk about PTSD, post-traumatic stress disorder. It's a psychiatric disorder that occurs in some people who have had a traumatic experience of being severely injured or threatened, or actually just seeing other people harmed or killed. And PTSD only results from human events. People don't get PTSD because of tornadoes. They get only PTSD as a result from human events. Symptoms of PTSD include frequent distressing recollections, and we call these flashbacks, nightmares about the traumatic event, avoidance of situations that may remind them of the event, and an exaggerated arousal in responses to noise and other stimulus. PTSD victims have a smaller than average hippocampus and have lower than normal cortisol levels. There are some new treatments for PTSD. Many of them are having to do with virtual reality, where they're putting PTSD sufferers through virtual reality machines back into the same situation that they experienced when they first got the PTSD. And so they're having the people go through the situation over and over and over and over again without the stressing event. For example, if one of these individuals got PTSD while they were in battle, they were driving down the road and IED exploded and several people were killed, what they will show through this virtual reality machine is them driving down the road and nothing happened. Driving down the same road, the same visual stimuli, and nothing occurring, no IED going off, just a really boring drive. And they'll have them go through it over and over again until they finally start wearing through the symptoms of PTSD. When we're looking at memory, there's all sorts of different types of memory. And it seems that the hippocampus is very important for some of these. We're looking at short-term memory. And this is the memory of events that have just occurred, as well as long-term memory. This is memory from previous times. A researcher named Donald Hebb, he theorized that any memory that stayed in short-term storage long enough would gradually be consolidated, that is, strengthened into long-term memory. Our working memory is simply temporary storage of memories about a task that one is attending to right at the moment. In short-term memory, the hippocampus is entirely important. Amnesia is a memory loss, and it's most commonly due to damage due to the hippocampus, and it produces this powerful kind of amnesia. People with hippocampus damage, there's a very famous patient, and he goes by the initials HM. He had his hippocampus and surrounding brain tissue removed from both hemispheres in 1953 to treat a severe epilepsy. However, he suffered moderate retrograde amnesia, that was loss for memory events that occurred shortly before the brain damage, but he suffered severe anterograde amnesia, which is loss of long-term memories for events that happened after the brain damage as a result of this hippocampus surgery. HM's short-term memory remained intact, so he could remember things for a very short time, but the surgery severely impaired his ability to form long-term memories. He showed no ability to form episodic memories, that is, memories of a single event. He also had better implicit memories. These are influence of a recent experience on behavior, even if he doesn't realize that this memory is actually influencing his behavior. So he had better implicit memory than he did explicit memory. And explicit memory is this deliberate recall, be able to say what just occurred. Although he lost his ability to state his memory in words. He retained his procedural memory. So that was the development of his motor skills. So he was able to acquire new skills, but he wouldn't know how he acquired those skills. We learn in context. So recent memories have a significant detail, and they depend on the hippocampus. Older memories, they have fewer details, and they are less reliant on the hippocampus. Recalling recent memories activates the hippocampus. However, recalling older memories may not require the hippocampus involvement at all. This researcher, Hebb, he proposed that short-term memories are gradually consolidated, they're strengthened into long-term memories. Several animal studies cases of the hippocampal damage suggest that the hippocampus may be necessary for this memory consolidation, for moving short-term memories into long-term memories. Researchers, however, they're not sure what consolidation actually is or how it develops. Hebb guessed that consolidation depends on time, but it is clear that long-term memory storage depends on more than time. Factors such as emotional response have effect on large-term memory. And I have some slides here showing short-term memory. So in just a moment, I'm going to flash up a series of nonsense words. They'll stay on the screen for 7 seconds, and as soon as they go away, try and write down the words that you remember. Here we go. There you go. Now try and write those words down. Got it? How'd you do? Now we're going to one more slide. It was a longer series of words this time. They'll stay on the screen for 7 seconds, and as soon as they go away, see how many of these you can write down as an example of your short-term memory. Now try and write those down. You probably didn't get too very far on this. Might have got 2 or 3 of them. The most just about any average human being can do is 7. So, and you can improve your short-term memory through practice, but it's very difficult. And this is short-term memory, just how long you can hold this in there. There are many other types of amnesia. The most common other type is called Wernicke-Korsakoff syndrome. And this is brain damage caused by a prolonged thiamine deficiency. And this disorder is most commonly seen in chronic alcoholics. Korsakoff patients show apathy, confusion, and have trouble reasoning about their memories. And confabulation is very, very common. This confabulation is making up an answer to a question and then accepting that invented answer as if it were true. This is a common symptom of Korsakoff syndrome. There is also another common one, Alzheimer's disease. It's a dementia that becomes more prevalent with advancing age. Symptoms include short-term and long-term memory loss, confusion, restlessness, hallucinations, and a disturbance of eating and sleeping. People with Alzheimer's disease have a better procedural memory than a declarative memory. That is, they're actually able to do something rather than talk about something. The role of other brain areas in memory. Almost all cortical and subcortical structures are involved in some aspect of memory. The amygdala is important for fear learning, and parietal lobe damage affects the ability to associate one type of information with another type of information. For example, the face recognition of emotions in other people. So here I have a few slides. When you look at her face, and here's a list of emotions to choose from, which emotion would you say this face is? If you said disappointment, you would be correct. How about this one? Choose from this list. If you said fear, you would be correct. And here's another one. And that's a pretty easy one. That's happy. How about this one? And that would be mad. And here's one. And this young lady is sad. And finally, and another pretty easy one. She is showing surprise. Habituation is a decrease in response to a stimulus that is repeated repeatedly, or presented to you repeatedly, and is accompanied by no change in other stimuli. So in other words, you get used to something, and you don't notice it anymore. For example, the feeling of the clothes on your body. Your body rapidly becomes habituated to this, and you simply don't feel them anymore. Just the opposite of this is sensitization. This is an increased response to a mild stimulus after an intense stimulus has been presented. So you smell a really noxious odor at one point, and then at another point you just get a small sniff of it, and you can remember it right away. You become very, very sensitive to it. You pick it up. And women, however, have a higher sensitivity rate than do men. When we look at the lateralization of functions, that your left hemisphere of your brain and your right hemisphere of your brain are responsible for different types of functions. Because the brain does have two hemispheres, and each hemisphere controls the opposite side of the body. So stimulation from the right side of the body goes into the left side of your brain. Stimulation from the left side of your body goes into the right side of your brain. Your corpus callosum is the set of axons that allows the two hemispheres to actually exchange information with one another. In the term lateralization, this refers to the behaviors and the cognitive abilities that each hemisphere specializes in. For example, language is primarily located on the left side of the hemisphere. Visual and auditory connections to the hemisphere. Light from the right visual field shines into the left half of both retinas. This information is then relayed to the left hemisphere. Right from the right half of each retina connects to the right hemispheres, which sees the left visual field. So everything you're seeing over on the right-hand side is going to your left hemisphere. The optic chiasm is the point where these two nerves cross to the opposite side of the brain. Now, when hearing, each ear receives sound waves from one side of the head, but each sends the information to both sides of the brain. If the two ears receive different information, each hemisphere pays more attention to the ear on the opposite side. So even though the information is going to both hemispheres from your ear, the left hemisphere pays attention to the right ear, the right hemisphere pays attention to the left ear. When we cut this corpus callosum, that the severing of the corpus callosum prevents the sharing of information between the brain. Epilepsy, excuse me, epilepsy is this condition characterized by repeated episodes of excessive synchronized neural activity. In other words, a seizure. And about 90% of epilepsy is controllable by drugs. If the seizure activity is not controlled by drug therapy, some people have the surgery to remove the focal point, the focus of the seizure. Alternatively, epileptics sometimes have their corpus callosum severed to prevent seizure activity from crossing from one hemisphere to the other. And these individuals are referred to as split brain people. Split brain people can point to objects with their left hand, but not their right, if visual information is presented from the left visual field to the right hemisphere. If information is presented to the right visual field, thus going to the left hemisphere, it allows the patient to actually name or describe what they see. The left hemisphere is dominant for speech production in about 95% of right-handed individuals and for about 80% of left-handed individuals. However, the speech comprehension is less lateralized, so both hemispheres can actually produce speech. The two hemispheres of a split-brain person can process information independently of each other. However, the brain eventually learns to use smaller connections between the left and right hemisphere to avoid conflicts. And I have a couple of videos that I'm not going to show in this one, but we'll show them in class. The right hemisphere is better than the left at perceiving emotions in people's gestures, facial expressions, tone of voice. People with right hemisphere damage speak with less inflection and expression, plus they also have problems interpreting emotions that other people express. Research findings suggest that the right hemisphere is more adept than the left at comprehending spatial relationships. And the left hemisphere is more focused on details, and the right hemisphere is better comprehending the overall patterns. Differences in hemisphere specialization can be demonstrated in people without brain damage, but most of these differences are very small.